Well, late last night, I was contacted by the UK Health Security Agency. I was informed that they have detected 2 cases of this new variant, Omicron, in the United Kingdom. One in Chelmsford, the other in Nottingham. The 2 individuals concerned are self-isolating alongside their whole household, whilst further tests and sequencing is carried out and contact tracing. The 2 cases are linked. Now, we've been always very clear that we won't hesitate to take further action if that is what is required. And today I can announce one thing that we are doing immediately is carrying out targeted testing and sequencing of positive cases in the 2 areas that are affected. And secondly, we are adding 4 more countries to the red list from 4 a.m. on Sunday, and those are Angola, Mozambique, Malawi and Zambia. If anyone has travelled to these 4 countries or any of the other recently red-listed countries in the last 10 days, then they must self-isolate and take PCR tests. And lastly, this is a real reminder to us all that this pandemic is far from over. And if there's one thing that everyone can be doing right now is, if they're eligible, please take your vaccine. Whether it's your first shot, your second shot or your booster jab, if you're eligible, please take your vaccine.
As always, I must stress this, as always with a new variant, there are many things that we just cannot know at this early stage. But our scientists are learning more hour by hour. And it does appear that Omicron spreads very rapidly and can be spread between people who are double vaccinated. There is also a very extensive mutation, which means it diverges quite significantly from previous configurations of the virus, and as a result it might, at least in part, reduce the protection of our vaccines over time. We need to slow down the seeding of this variant in our country. We need to buy time for our scientists to understand exactly what we're dealing with, and for us to get more people vaccinated and, above all, to get more people boosted. But we now need to go further and implement a proportionate testing regime for arrivals from across the whole world. So, we're not going to stop people travelling. I want to stress that. We're not going to stop people travelling, but we will require anyone who enters the UK to take a PCR test by the end of the 2nd day after their arrival, and to self-isolate until they have a negative result. So, in addition to the measures we're already taking to locate those who've been in countries of concern over the last 10 days, we will require all contacts of those who test positive with a suspected case of Omicron to self-isolate for 10 days, regardless of your vaccination status. We will also go further in asking all of you to help contain the spread of this variant by tightening up the rules on face coverings in shops and on public transport. From today, we're going to boost the booster campaign. We're already planning to do 6 million jabs in England alone over the next 3 weeks, and now we're looking to go further. So the Health Secretary has asked the JCVI, the Joint Committee on Vaccination and Immunisation, to consider giving boosters to as wide a group as possible, as well as reducing the gap between your second dose and your booster. The measures that we're taking today, including on our borders and on face masks, are temporary and precautionary, and we will review them in 3 weeks. At that point, we should have much greater information about the continuing effectiveness of our vaccines.